Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader as a follower, and the leader as a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty. Episode 49 of HLA Live is a special episode for World Refugee Day. In this episode we explore whether international NGOs hinder local NGOs in the provision of healthcare to migrant populations. It is hosted by Flora Jobson.
Hello, my name is Flora Jobson and welcome back to another episode of HLA Live. Today we will be discussing the role of non-governmental organisations in providing healthcare to migrant populations. A non-governmental organisation is a non-profit group that functions independently of any government and may be referred to as an NGO. At a time when 1% of the world's population have fled their homes as a result of conflict or persecution, the work of NGOs has never been more important. Over the past few decades, the number of international NGOs has exploded to meet increasing humanitarian demand. With this expansion comes increasingly complex relationships between NGOs, and today we will be discussing whether international NGOs hinder local NGOs in providing healthcare to migrant populations. We have 3 excellent panelists with us for this discussion. Our first panelist, Dr. Tamam Aloudet, is a medical doctor and public health professional who is currently the managing director of the Global Health Centre in Geneva and has worked for Médecins Sans Frontières in many different roles, most recently as a senior strategic advisor for their Access campaign. He's also worked for the International Red Cross as head of operations, overseeing operation of the refugees crossing from Libya to Tunisia. Dr. Aula Abara is our second panelist, who is a consultant in infectious disease and general internal medicine. She has volunteered in many different humanitarian and refugee settings. Her work has predominantly been with Syrian NGOs, and she is currently the co-chair for the Syria Public Health Network. Between 2016 and 2018, she was also instrumental in a project that provided over 30,000 primary healthcare consultations for refugees in Greece. And finally, our third panelist is Claudia Meyer, the Associate Director of Global Public Policy Institute in Berlin, where she works on humanitarian action, migration and peace building. Her core interests lie in facilitating organisational change and studying how humanitarian organisations adapt to insecurity and involve people affected by crisis in their decisions. She managed Interpieces programs in Burundi and Rwanda and has also worked for the UN Office for the Coordination of Human Affairs and for the Norwegian Refugee Council in Geneva. Thank you to all 3 of you for joining us today. And the first question I would like to put to our panelists is, do international NGOs hinder local NGOs? To what extent and how?
Thank you very much, Flora. Thank you for having us. And it's a pleasure to be able to speak. So I think they can. They don't have to hinder the work of national NGOs, but they can and they often do. This is probably partially historical and partially biases and assumptions. I have worked most of my career in medical humanitarianism, and it has a bit of specificity. So historically, humanitarian NGOs came to places that were devastated. MSF now is 50 years old, and 50 years ago, most of the places had extremely low resource settings and had very little capacities to work on their own, especially on medical issues, and very little ability to provide medicines or medical facilities in the middle of big emergencies. Now, this creates a mindset whereby there's an assumption that there are people coming from the outside, not only to provide aid, but to decide on what aid gets provided, to whom, and in what capacity, towards what end. It is absolutely rare that this needs to be the case anymore. Yeah, in my 20 years of career, I remember 2 occasions, the Indian Ocean tsunami and Haiti earthquake, where there was zero capacity in the immediate aftermath of a massive natural disasters. Otherwise, there's always been local capacities, there's always been local ability to judge the situation. I think the hindrance is that assumption that continues to go on, but also in the medical field as well. It is a narrow view that keeps medicine as a supposedly a technical, scientific, professional thing that is independent from all else. And it isn't, and it's never been, and it shouldn't be. But doing that allows the discarding the opinions and desires of local communities at will, and deciding on supposedly technical basis what they need, despite their opinion, rather than because of it. This is not always the case, but it does happen frequently enough to be troubling.
From my experience over the last almost a decade now of the conflict in Syria, I see a lot of nuance to this discussion. So for international NGOs, they are under very different pressures than perhaps national or local, so-called local NGOs. And of course, that's a word that's in itself can be very controversial. And by that, I mean, they may be under pressure from donors, from politics, from international priorities. There's a joke among Syrian NGOs and Syrian national staff that things come in and out of vogue. So, for example, maternal and child health might be the topic of the season, and the next time it may be FGM, for example, or it may be underage marriage, and then onwards. And these sort of almost fashion trends in the NGO industry don't always bear context or reality to what's happening on the ground or to the local contextual priorities. And what you find, and this is part of the discussion when we're talking about international NGOs or so-called local NGOs, is this difference in the power dynamics which Tamam started to touch on. The international NGOs, more often than not, have the upper hand in terms of power. They're often the people that are funded by international donors, whether it's country or private donors. And so they come to partner with local NGOs, and they are often setting the agenda, which can of course be very problematic if they are not understanding or not even respectful of the local culture, the socio-political context, or even the kind of local priorities in terms of humanitarian needs. And so what you end up with is an often jarring dynamic between these international NGOs, who of course have come with their own policies, their own agendas, their own priorities, and then for local NGOs or national NGOs who are on the ground, often staffed by national staff, who may have a weaker voice, let's say, in terms of being heard in the health cluster, on the local stage, or even in the international stage in terms of defining priorities, which are often based on the local need. Something to reiterate, which Tamam highlighted, is just that we're not just talking about local or national NGOs. What we really need to be talking about is community-led priorities, because often that voice is unheard, and that arguably is the most important voice. The other thing from my experience of, I suppose, observing the dynamic between the local NGOs and the international NGOs is often, and I'm going to use the example of Syria where I've got the most experience, there's a sense of looking at Syria as one context, whereas of course we know that there are multiple micro contexts within Syria's national borders. And that's not just the geopolitical context, but also within these areas, whether you're talking about the northwest, the northeast, areas under government control, there are multiple priorities which the humanitarian sector needs to be responsive to. And what we find is local NGOs may well be able and willing to respond in that micro context in a way that's locally and culturally acceptable. And of course, they may come from within these communities and be very trusted and respected within these communities, compared to international NGOs who may not necessarily understand the nuance, for a variety of reasons, of understanding the different micro contexts which occur and the different priorities that are needed there. The other thing that perhaps we need to think about, and I'm hesitant to say sympathy with the international NGOs, is the different pressures that they are under. So sometimes when I think of an international NGO, I think of all their policies, their charters, their reporting needs, the priorities of their donors. And if you think about it, when Syrian NGOs first started to respond in 2012, 2011, 2012, and I think we must remember that, and Tamam, I'm hoping we'll be able to speak more about this, they were crying out for a humanitarian response in many areas, and that didn't happen. And that's why Syrian NGOs had to come up and serve their local populations, whether they be local or expatriate Syrian NGOs, as we have seen. And it took a bit of time for actually the international humanitarian organizations to respond in the way that was needed and in a way that was meaningful and impactful in that local situation.
Thank you so much for sharing your experiences from Syria. That's been extremely valuable. Claudia, when you heard this question, what kind of response came to mind?
It's really nice to be the third person speaking, because there's so many kind of seeds in what Tamam and Aula have already said, and what I can speak to is more this kind of a bit of an observer perspective. I can claim to speak on behalf of national NGOs, so I will rather share something that's more than related to kind of governance perspectives, and some of them have already run through, in especially what you said now, Aula, about the power questions, who actually sets the agenda, but also this like the small piece around like sympathy for international NGOs, because what I'm seeing a lot, I mean, there's a big international agenda that tries to get this right. There have been talk about localization and making sure that that national NGOs get more direct access to funding. So there's not a lack of goodwill, and there's certainly change agents in national organizations and also international ones that really want to get this right. But what we observe a lot, especially when we are asked to do evaluations of whole responses, is that the clock seems to be turning backwards. So recently in Ethiopia, there was this trend where right after this grand bargain, which is one of these big international reform initiatives, there was actually an increased access to direct funding among national NGOs. And then 2 years later, the kind of trend passed and it dropped back to the previous level. So this just suggests that it's not about individuals in these organizations, but that there are bigger forces at play and incentives that I think would be interesting to unpack a little bit more. And there's historical precedent to that, right? There are a lot of pieces of research that look at certain countries in the 1960s when international actors came in as non-operational entities and actually relied quite a lot on national NGOs to drive the response. But as soon as they switched to actually also having staff on the ground, those national NGOs got crowded out. So there is a dynamic that has been there for a while, but what seems to, at least kind of in my perception, seems to become more dominant is just this growth paradigm that drives everything among international actors. And it's just a thing that powers this dynamic, and a lot of international NGOs, they operate a little bit like corporations where they leverage size to also compete for funding. So this is just something that I think drives a lot of these dynamics, because if your business model depends on your growth, then you're not letting go of power. So that's one observation, maybe a little bit beyond the health sector that seems to to shine through a little bit across very different contexts.
Thank you so much, Claudia. There's a lot of points that have come up from that already. Something that actually has surprised me and struck me, and I didn't kind of think about would be an answer to this question, was Aula, you mentioned that the local organisations were wanting, one way they were hindered was by the fact that they were wanting an international NGO to come in, that they needed more support. Tamam, as someone who's worked with international NGOs, can you come in on this and kind of give your perspective on this?
I come to this discussion from having 20 years long transformation from absolutely fascinated, taken and co-opted entirely by the system of international NGOs, which I never thought I'd have the opportunity to join when I set up to try it. And going through every stage of realization and disillusionment. And every critique that I put forward is something I have done myself and I regret. So this is not a j'accuse moment. This is a self-reflection. I was reading a book about political economy of health that was written in 1979. And they're talking about the orthodox view of medicine. And they say, medicine is seen as a biological, determined biologically. And now we don't anymore, supposedly, because we talk about the social determinants of health, but we do not talk really about the social determinants of health. We have categorized like poverty, gender, a few other things, and call them social determinants of health. The determination of health is political, is social, is economic, and it goes beyond the polite, or let's reduce poverty, or let's have gender equality. There are so many factors that are absent to an exclusively external gaze. That goes to the second point, is that medicine is treated as a science. And the first initial reaction, of course it's a science. Yes, part of it is, but another part isn't. And the critique here is dealing with it as a pure science, as a natural science, as they describe it, allows the separation between the doctor and their patient, as is the separation between the scientist and their subject, whether this is the animal, the cloud, the stone, the whatever. It objectifies people we work with. And it's unfeasible because it's affected by culture and environment and politics and everything. So all that comes, we still pretend to go and do an assessment. The assessment is given this, halo of professionals, right? It's science, you go and assess. But I can promise you, you send 5 different people to the same context, and you'll come with 5 different assessments and 5 different recommendations, and hence 5 different humanitarian operations. So accepting the subjectivity, how come we still deal with it as a subjectivity that is only afforded to people from the outside? This has carried, the capacity, there's no capacity locally, carried that we know better because we have experience. And all that started crumbling with the Arab Spring, because humanitarian operations moved from largely places that are rural, sub-Saharan African. Even those have a lot of capacity. Look, many of the doctors that join MSF now come from Rwanda and Congo, which we still pretend has 0 capacity. But the Arab Spring puts humanitarian aid in a place where people are equally or better trained than most of the expats that come in. And that, I'm talking about Syria and Yemen and Lebanon and Libya and so on. And where the comfort of, I know sub-Saharan Africa crumbles because no one knows the Middle East. The Middle East doesn't know the Middle East. It's a whole pile of microcosms that require real understanding. And there's no comfort in, but I went to Syria once and I know how to say khalas and inshallah, hence I am an expert of the Middle East. And you see the shock, and you see how we have moved from that into the realization, into the denial of, but there's nothing that can be done. But there are things that can be done. Once we move away from trying to invent local capacities that are carbon copies of international capacities. And I will just stop with a little example. One of the most controversial humanitarian issues in Syria was the White Helmets, a local humanitarian NGO that has saved the lives of thousands of people in places international humanitarian didn't reach. And you will see many of my colleagues say, oh, but this is a politicized organization that is funded by the Americans. Half of the world is funded by the Americans, but no one accuses Save the Children of being cronies of, neoliberalism and imperialism. But well, we have talked repeatedly about the failures of humanitarian neutrality and this delusion of apolitical humanitarianism, which is in itself. And we still use that among many others. So they are either too political, hence they don't qualify as humanitarian, or they don't know how to speak English well, write log frames and grant proposals, hence they don't get money. And again, one of the ideas is maybe we can have a look and think that, not every humanitarian version needs to reflect one that exists already. MSF was a radical departure from the ICRC, and we have to accept radical departures from MSF as a new legitimate humanitarianism, just as an example.
Thank you very much, Tamam. I think we will move, in the interest of time, just to speak a bit more specifically, and I think I'll probably be looking at Aula to answer this next question. What are the repercussions if NGOs don't work together collaboratively?
So early in the response to Syria, there was a cry out for, we need support, we need international support from humanitarian organizations. Now, fast forward 10 years, that's not what the Syrian NGOs are saying. They're saying, we've been active for almost a decade, many of them. They've always been accused of not having sufficient governance or audit trails. Well, they have all of that now. Because they were told that's why donors weren't interested in funding them directly. They always had to go through a go-between, which was usually an international organization that took an enormous overhead that could very much have saved the lives of people on the ground. And I just wanted to make that really clear, because I'm not someone that would advocate for international humanitarian interventions in most settings. The only time, as I think it was Tamam or Claudia who said, when the local health system is so completely overwhelmed that they need that extra support. And I think it's important for us to mention COVID-19 for the first time and remember even Europe, the US, and other so-called high-income countries needed humanitarian support because their health systems were overwhelmed during the COVID-19 pandemic. So again, I want to step back and think about the dynamics between the international organizations and the so-called local organizations. I have honestly yet to see a partnership with an international and a local organization that is smooth sailing, where the agendas match, where there is equal power, where the local humanitarian organization is fully listened to and given the opportunity to express the needs of the local population, which arguably is a lot more familiar with, and also to give power and voice to the local communities who need to be supported during these times. And I think if you start thinking about this power dynamic between the international and the local organizations and the priorities that each may have, you can see a tangle between these. And of course, they can have very much an impact on health. Tamam is very correct in saying Syria, the Arab Spring, and that region, I don't like to call it the MENA region, but that region that we're discussing has been a game changer for the humanitarian, let's call it an industry. And I think Tamam is very correct. So there's people that come to work in Syria whose experience has been very much sub-Saharan Africa or Southeast Asia, and they think that they can implement those basic standards. It was in what was formerly a relatively well-functioning health system, albeit one that wasn't perfect in Syria. In Syrians that we treated in Greece, one of the challenges that the humanitarian organizations had was Syrians know what good healthcare is because they'd had decades of prior experiences in a health system, and with Syria's health system, it was imperfect. It now is vastly imperfect given the protracted conflict. but it was more skewed towards secondary care or specialist care. So the primary healthcare system was underdeveloped, and patients were very used to shopping around, choosing the best specialist for the condition that they had. And of course, for international NGOs, they will focus very much on, I suppose, the basics of healthcare, the sorts of things they had been used to focusing on in other international humanitarian settings. The reason that's important in Syria, and I have to admit that I was skeptical at the very start when my Syrian colleagues started to talk about things like the need for dialysis, the need for neonatal intensive cares, the need for what we might consider as super specialist treatments that don't come in into a humanitarian setting, through conflict and then onwards. But actually, if you look at the socio-political, the geopolitical dynamics within Syria, and if I just focus in on the northwest, where early in the conflict, with the criminalization of the delivery of aid and healthcare to those considered opposed to the government, and the essential withdrawal of the Ministry of Health and the traditional healthcare providers from the northwest, when these areas were under opposition control, there became a need for humanitarian organisation, most of whom were the local the national or the expatriate Syrian organisations that we are discussing. Many with support from international NGOs, had to come in and be responsive to the needs of the local population. The reason Syria has been a game changer is because it had already transitioned from communicable to non-communicable diseases being the most important cause of mortality and morbidity, and just managing NCDs in this context. And that includes those that are so-called simple to manage, hypertension, diabetes, but also those are far more challenging. So chronic kidney disease, particularly those patients who need dialysis, needed to be provided. And actually the Syrian humanitarian organisations have stepped up, and there's some very good examples from the Syrian American Medical Society and others of renal physicians who've been able to support low-cost dialysis interventions for people who are very much in need, who would have suffered tremendously had they not been able to access this. And these higher cost interventions are certainly not those that would have been prioritised by international NGOs. Just before I stop, I'm going to mention some of the other high cost conditions, which may include oncology care. And bearing in mind for the 4.2 million or so people in northwest Syria, where they don't have adequate access to healthcare, and the international NGOs may not be able to support these higher cost interventions. So the Syrian and local NGOs have stepped up to support these based on the needs of the local population. So in summary, if we don't get these partnerships, these dynamics correct between the international humanitarian sector, which does have a role and is important in many ways, with the local or national NGOs who aren't empowered to set many of the humanitarian agendas in these contexts and micro contexts that they're very familiar with, of course the health of the local populations are going to be very much and very adversely affected. And in fact, the costs of interventions may in fact be higher, which of course isn't good for anyone working in this sector.
Thank you, Aula. All three of you have agreed and discussed that the relationships between these NGOs is incredibly complex. Kind of shifting the dynamic of the conversation, maybe we could talk about how NGOs can support the work of each other, how international NGOs can support local NGOs, or perhaps, in your words, Aula, how we can empower the community-led voice. And perhaps also, while we're on this question, how can we incentivize these changes? Because it's all well discussing what we can do, but how can we ensure that these are implemented?
One thing I keep hearing a lot, and that keeps frazzling me because I thought we were further than that, is just the basics around like overhead funding that allows organizations to grow and establish their own systems. Sometimes in the context of Northeast Syria, there was kind of a recent example of about a year ago where several national NGOs were telling me they're not even paid for security, and like literally just the costs that they can recover from an international partner is literally getting stuff from A to B, and really nothing else. So I think that's there's something in there of just making it a rule that such overhead funding needs to be paid, and then the question is where is the incentive and who can be responsibilized. And the ultimate level in this are government donors who often don't really have. So, for example, the European Commission, ECHO, doesn't have, with a few framework contracts they have with UN organizations, they're not even allowed to know what happens after they disperse funding to a UN organization. So that creates this dynamic where international actors can basically do whatever they want in the subcontracting scheme. So I think donors have a key role to put a finger on that and request accountability from anyone who's kind of in between on this very long and longer subcontracting chain that actually, as Aula put it, kind of eats up the money that should go somewhere else. So that's kind of fixing things within this, within the relationship. But then the question is, how can we grow out of that dependency as well? And there are a few mechanisms that have been created to make it easier for national organizations to access their own funding. There's these like pooled funds at country level, which are supposedly should make it easier for national organizations to get their own funding, but oftentimes that still then goes through international organizations because they have weird regulations around having an international bank account or other things that just seem like those are bureaucratic obstacles that can also not be in place. And then the question is, why are they still in place? And that goes back to the power dynamics. So I think, yeah, it's about fixing what's going wrong in the subcontracting dynamic, and that includes then this question of like, okay, whose priorities are we following, but also just making sure that there's more opportunities for national organizations to then set their own agenda based on what they understand from the local context.
Thank you, Claudia. Perhaps we could come to Tamam.
I think, look, there are two layers. One is, how do we do now to sort of augment the system so that kind of unbalanced practice of power gets better. And then there's the part of what system do we actually want or need. And I'll touch on the first one here. And I think there's a conceptual issue, right? There's one that accepts that there are different levels of knowledge and skill, all of which are useful, none of which is more important. So we've pushed quite hard in the beginning about the local knowledge of the context and the ability and the evaluation of the situation and so on. International NGOs have very valuable knowledge of other contexts, other emergencies, stuff that get learned. So if we go back to Syria and Yemen and Iraq and Lebanon, there are stuff that have happened there that wouldn't have been coped with easily by local, particularly because there has been a very reasonably functioning health system. Doing surgery on explosive weapons is something that no one knew how to do before, and it required outside surgeons who had that experience to help initiate it. Prosthetics, treatment of measles outbreaks, polio outbreaks that happened in Syria, something. So there are, humanitarian medicine is a set of multiple disciplines that interact, and some of them are very particular skills. So accepting that there is a need for people from different backgrounds, some of them are from the community, some of them from the country, and some of them from the outside. However, that has to be done on an equal footing, where this whole power structure that only exists because of the flow of money needs to go away. We should know better as humanitarians that the fact that I donate the money or I carry the money over doesn't make me any better. Now, this is easier to argue today because you know what? We used to be told before, oh, but you can't do that. People are not detached, are not neutral, are not impartial. They will, from the blunt accusation of, you give money to local NGOs and the corruption will start instantaneously. All the money will be stolen before you turn your back. Two, but there's no capacity. Two, they are too much engaged in the local politics. the moment you have the European migration crisis, quote unquote, and COVID, and they don't start importing Syrians and Jordanians and Congolese and so on to run the operations in Europe, because the French and the Greeks and the Germans are going to be too detached, too unable to detach from their local politics and government, then there is a problem with the argument. So let's take that argument, as ludicrous as it has revealed itself to be, aside and start talking about an actual partnership where people sit and work together, where there is a real sense of solidarity rather than charity, and where we have some respect, some basic democracy, and try to save people's lives. And I still buy completely into the separation between the humanitarian and developmental. The developmental talks about a future where less people are poor and hence sick and die. And the humanitarian is about there are crises whereby we really need to help people survive so they can be less poor and not die in the future. And in that sense, there is a view where those capacities and the risks and privileges are used. The last thing I will say about this is the Extinction Rebellion are brilliant. This is a movement without leaders, and they're smart enough to sit and think about stuff. So they've put a book out, the UK one put a book out a while ago called This Is Not a Drill. And it had an argument by the president of the Maldives all the way to the guy who cooked food for the protesters. But one of them was significantly strategic. In a protest whereby your aim is to get arrested, if you only go, if not getting arrested becomes a stigma, then only white privileged kids will go because they don't care if they are arrested. So they've created a system whereby everybody goes, but those who don't care if they are arrested go in the front and protect others. In Syria, you need international NGOs to protect, because the presence of white people in a hospital in the field might make it less likely for it to be bombed. On the other hand, you need the local knowledge and access and language and knowledge of the culture and habits and customs and so on. So there needs to be that move from a hierarchical to an equitable. And we have some examples that are starting to materialize from younger generation concerned with social justice and causes that we can really learn from.
I very much second everything that Tamam has said. I was going to give quite a technical answer, but actually, I think one of the most important things is humility. One of the most important articles I read in the New Humanitarian in the last few days was around how they weren't talking about humanitarian actors, but actual humanitarians, that they must be humble, that they must learn humility and must practice it. And I think if you start with that and you don't have an international NGO or humanitarian system whereby people are going into it for what may arguably not be the right reasons, I think we as a humanitarian community, and I mean that in its broadest sense, will do an awful lot better. One thing in this discussion about international NGOs and local NGOs is the sort of almost colonial or patriarchal or Western perspective of humanitarianism. And for me, as a person, as someone who is Syrian, but has the privilege of having been born and worked in the UK, as part of my personal reflexivity when I volunteer in different situations, I certainly don't go with the attitude of, I know an awfully lot more than Syrians who are working in the local Syrian context, who are living it day in, day out, breathing it day in, day out, understand Syria and its health system and all the different pressures there in a way that I simply never can understand just by visiting it for a few weeks here or there. And I think that's important for all of us who may work either with international or local NGOs, or at any time, you might go out for a few weeks or a few months with a particular organisation to support the local health system, is all of us must remember that reflexivity and humility in our approach. I can honestly say, and hope that's borne out, that I have never spoken down to a national or a local Syrian doctor or staff member. When I was with Médecins du Monde, which obviously is an international NGO responding to the Ebola epidemic in Sierra Leone. We were in Moyamba. One of the kindest things that I've ever been told was by one of the community healthcare workers who was seconded to the facility that we were working in. And it was her reflection around how some of the international doctors and nurses came with the attitude of, we know better. I can never say that to a local healthcare worker who had been working through the Ebola pandemic for at least a couple of years by that point, and beyond that had suffered unimaginable loss in terms of their own family and all, everything that they would have suffered at those times. And I was coming from a place of privilege. So again, this ties into those discussions about power dynamics and what we can do about them, and these important discussions that we are currently having around decolonizing different kind of academic institutions, etc., but also the humanitarian system. Because arguably, and again, this has been shown by the context in Syria and other similar contexts in the COVID-19 pandemic, but also in what happened in West Africa in terms of the Ebola pandemic, that our humanitarian systems aren't fit for purpose. They're not responsive enough. Many of the international NGOs have become particularly cumbersome and bureaucratic in the way that they respond, and also in their willingness to respond to certain situations. One thing I would like to highlight here is something that we haven't explicitly mentioned, which is what it must feel like to be working, whether it's for let's say for an international NGO, but to be designated a local staff member versus being an international staff member, because automatically your rights are somehow different, and the way perhaps you are viewed, and perhaps going to be quite direct, perhaps the value placed on your life because of where you are from is automatically different. And I think we need to acknowledge this, and I say this as someone who is clearly foreign, albeit someone who has grown up in the UK, versus someone who may be fully Caucasian, who is working in that context, versus someone who is from the local community in terms of the risks they may face when they are signing certain documents on behalf of international NGOs that could put them at risk in terms of their security and that of their local families. And these are the sorts of discussions that international organisations need to understand, because many of them won't get these nuances, but also for staff members who are national staff, but also local NGOs, to be able to speak up about these issues, to be heard, and for there to be mitigations around this. And then I'm just going to end by saying the other important thing which relates to this is for there to be, so I suppose, examination of these strategic partnerships, because arguably international organisations and local or national organisations do need one another, and there are natural synergies and perhaps symbiosis to address the health needs of local populations. How this is done and what it can achieve will be the next step in understanding these partnerships.
Thank you so much. The message of humility, both at an individual and organisation level, is a very powerful one. I think
another one, though, because I think there's also like things that we need to call a spade, and a lot. Our sector has a deep racism problem, and I found it interesting that we talked a lot about like what the Arab Spring did to kind of perceptions, but a lot of that was just also that it pulled back the veil on substandard, or like at least a double standard in kind of medical rights to medical services that has been kind of accepted because it was people were not standing up to it, and were not saying like, no, this is not what I'm used to, because they didn't have the comparison. So there's as much as there's the racist undercurrent there's also the racist undercurrent in this like argument that Tamam was laying out with like the corruption assumptions. I mean, if you look at the actual evidence and the massive scandals that came out over the past years, both in terms of corruption and abuse at large scale in international organizations, that's just not an argument you can still make with a good conscience. So yeah, just kind of going one level beyond the kind of humility, which I absolutely agree with. There's also like a need for anyone especially Caucasian, to be aware of their privilege and do basically go through a critical whiteness training to just see what they're not seeing, and what they have been basically educated into believing based on where they came from and what these systems are based on.
If I may, this is absolutely important, but can I try to sort of, it is there and there is a racist undercurrent, and this is sort of like a reflection of society, right? There is, you know, we all live in Europe, we know that this sort of plays at different depths and different emphasis and everything around us. But then it's not only that simple. I wish it was, you know, I wish it was just, you know, animal farmy kind of 2 legs bad, 4 legs good, and we're done with this. It's not. You know, you look at it, and on the one hand, national staff are discriminated against systematically. Suddenly, the same guy who is without authority or voice manages to become an expat, and suddenly their status, it changes. They become more important, maybe not very important, but more important. You get some of the secrets that are only now very well emphasized is we've always, all NGOs have evacuation plans for international staff, not for national staff. That used to be wrapped in, but national staff are not at risk. They will go to their families. This became problematic when the evacuation plans became for chemical weapons attacks in Syria, because then no one is safe in their community. Actually, they are at a higher risk. When medical staff are targeted, particularly for being medical staff, the evacuation of international staff becomes a higher risk. So never, there isn't. In Ebola, international staff get infected, they will be evacuated to a hospital in Europe. National staff get infected, they effectively won't. So it's, and you know, let me just put another example. Global Health 50/50, which is an organization concerned with gender equality in global health, has put a report in last March. And, you know, well, the obvious 70-something% of CEOs of global health organizations are white men. But 89 or 80-something is people who have studied in specific global health organizations. So a non-white guy, and 2% are women of color, just so we put it in context. So dressing up as a European or American, and by that I mean assimilation, you know, dropping the accent, dropping the behavior, appearing less offensive, less, you know, weird, qualifies, whitens this. And this is not, you know, since we're talking about decolonization, this has been talked about 60 or 70 years ago. This is what Fanon brought about in Black Skin, White Masks. And suddenly the complexity of it turns us into instruments in perpetuating the system. So when you start having people of color or people from the South in the system, they don't end up changing the system, at least not initially. They end up justifying it and perpetuating the problems. And that's why I started my conversation by saying, every mistake I critique, I've done myself multiple times. And acknowledging that is important. I didn't do it because I'm, you know, a bad person necessarily, or only, I did it because this is how the system is designed. So that critical consciousness is not only something that white people or Northerners or Europeans need to acquire, it's all of us that need to acquire collectively, together, in a insistent struggle towards more equality. It doesn't work that we just, you know, paint one group and, you know, sanctify another and we're done. We need to all grow into a really significant critical consciousness in the future.
Thanks.
I'm aware that we are running short of time, and I think because so many points have been raised, an amazing amount of points, I think kind of to wrap it up, perhaps we could go around each person and say, if you had one message that you could give an international NGO, say if you had all of their directors of the top 20 largest international NGOs in a room, if you could give them one message in under a minute, so the pressure is on, what would your message to them be?
Stop trying to grow. It's not, you're not the only ones. Yes, every organization thinks they need to like become bigger because there's so many needs out there and they need to be the ones doing it because they're the best. You're not. there's others. So get rid of that factor that defines everything.
I suppose I tell them, well, I tell most politicians in liberal democracies, you serve the people, you don't own them.
I'm very impressed by my colleagues who managed to say that very shortly. I think the key message that I'd like to get across is don't assume one size fits all, and to very much listen to local communities and local actors. And then second to that, don't be afraid to lose the upper hand of power. Don't be afraid to transfer power to local NGOs, because there's a tremendous amount that you can do for the power of good in the humanitarian sector. But understanding that, because that has to be the future in the humanitarian sector.
Thank you so much. And thank you to all three of you for this past hour. I feel like with the points raised, we could have drawn this out into about a 20-part series. But thank you so much for bringing all of your expertise and experience. And thank you very much.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA scholar? Thank you for joining us. My name is Johan Marlwaner, the director of the HLA, and it's a good night from all of us.